Dr. Joe DeStefano here with Urgent Care 24/7. We're going to have a chat today about hypertension. Hypertension, again, is, as so many things, lifestyle dependent. First option and first step in treatment of hypertension or pre-hypertension is lifestyle modification. This, of course, includes better diet, 20 minutes of exercise a day, and regular follow-up with a primary care physician. Really, hypertensives need to be seen every 3 to 4 months by their physician to make sure that their medications are working, keeping things to target, they're not having any adverse side effects, and that their kidney function is not deteriorating. Hypertension is not a diagnosis that somebody can diagnose, give you a pill, and say, oh, I'll see you again in a year. In a year, a whole lot of bad stuff can happen. Hypertension also has been called the silent killer. I tell patients that if you're a patient that gets symptoms with their hypertension, you're actually blessed. Some patients, if their blood pressure becomes uncontrolled, they feel fatigued, they get headaches, they automatically can almost at that point go get their blood pressure cuff, check it, confirm their suspicion that their blood pressure is uncontrolled, and go see their doctor and get something done. A lot of people feel the same whether their blood pressure is 120 or 80 or whether their blood pressure is 240 over 120. Those patients can just stroke out and die in what we call the epidemic of the silent killer, hypertension. Hypertension has a genetic component. It runs in families. There are two broad categories of hypertension: benign essential hypertension, which is the hypertension that most people have. About 90% of people that have hypertension have benign essential. It's a historical name of interest. Hypertension back in the 40s was not considered an illness, and they described it in literature as benign essential hypertension necessary for good health. This is what Franklin Delano Roosevelt's doctor described his hypertension as, and of course hypertension killed Franklin Delano Roosevelt. But the name has persisted on in medical literature. So that is 90% of hypertensives have essential hypertension. 10% have a secondary. A secondary is your glands made you do it. You have some type of glandular problem, endocrine problem that is causing you to become hypertensive. This could be pheochromocytoma, where your body produces too much epinephrine, too much adrenaline hormone, we call it. Or you have Conn syndrome, where your body produces too much aldosterone, which is another stress hormone. Or you could have Cushing syndrome, where your body produces too much cortisone, too much cortisol. So those are your two broad types of hypertension. And really, we use certain guidelines. If somebody can be controlled with 1 or 2 agents to control their blood pressure, they probably don't have a secondary cause. But if you need to go to a third agent to control somebody's blood pressure, the recommendations is that they be screened for one of those other conditions. Another secondary cause of hypertension is renal vascular hypertension. This is hypertension you get because there's a problem with one of the arteries going to your kidneys. This can happen from hardening of the arteries when somebody ages, from smoking, bad diet. It can happen in females because they get what's called fibromuscular dysplasia. The muscles of the renal arteries going to the kidneys get too big and pinch off the arteries. That is what we call a surgically correctable form of hypertension. The doctors can go in, put a stent, open up that artery. The kidney is preserved, the kidney function is protected, and the blood pressure gets better. In essential hypertension, This is where diet and exercise help. A certain number of people with essential hypertension are salt sensitive. We call them salt sensitive hypertensives, and they can just eat processed industrial pork, which is loaded with salt, and they have a good day eating barbecue, and the next day they're in the ER with a hypertensive crisis. Too much lunch meat. Certain lunch meats are very high in sodium. Certain canned vegetables are very high in sodium. One subset of people with benign essential hypertension are sodium sensitive, and if they eat sodium, they will have an issue with their high blood pressure. Another subset of people, and this is a little bit of an argument about whether these people truly belong in the essential hypertension group or they belong in the secondary group, are what we call the insulin resistant hypertensives. These patients have high insulin levels, and insulin causes your arteries to contract and elevates your blood pressure. So these people, if they go out and eat a ice cream sundae and go on a carb binge, their insulin levels will spike and their blood pressure will go up. And then there's people that unfortunately overlap. So if they put salt on their watermelon and then eat ice cream, they're going to really have a big issue with their blood pressure. So again, avoiding simple carbs, sticking to complex carbs, being more focused in your diet to proteins and fats and less processed carbohydrates can actually be a lifestyle modification that helps control your blood pressure. The other thing with hypertension is a treatment philosophy of don't treat hypertension if you can avoid it with a medication that makes something else worse. Certain medications will help hypertension but worsen diabetes. So if somebody is hypertensive and insulin resistant or hypertensive and have diabetes, you want to avoid that situation. You want to use a medication that helps the diabetes, helps the insulin resistant, helps the blood pressure. A case in point would be the angiotensin receptor blockers, such as losartan. Again, with hypertension, this is a team approach with your primary care provider. It is something that we try to really focus on in our direct primary care model and our primary health care plan, and we take a holistic team approach with our patients. Thank you for this chat today. I actually enjoy speaking about hypertension. It is very important. Dr. Joe DeStefano for Urgent Care 24/7. Life is 24/7, and so are we.